ever, 25, 30 years.
Wow.
Hi, everybody. Thank you for coming. What's your name?
Thank you so much. I'm Carrie Wong.
Hi, Carrie. Hi.
I'm Laura Halverson.
Thank you for coming, Laura. Hi.
Heidi Case, nice to
Hi,
meet you.
Heidi. Nice to see
Becky
you.
Ogle.
Hi, Becky. Thank you.
Kent with United's final. Give one to
Kent, thank
Hi.
you. Hi.
I've seen you at many a Maryland now.
Oh, you all for coming.
Thank you for being here and supporting us.
Now, Angus, you have to go?
I do. I'm in the middle.
Okay, okay. Hello, everybody. Good morning. Thank you for coming. We've arranged for some nice weather, even though there are cloudy days ahead if health care passes, if TrumpCare passes.
Yes.
Okay, so I want to thank everyone for coming. My colleagues, Senators Stabenow, King, and our great senator from Michigan is joining us. Thank you, Chris Van Hollen. And they're going to be leading the fight in their states, as we all are, to ensure Americans get more affordable care, not less. I want to thank our guest speakers, who you'll hear from in a few minutes. These are the people who will be hurt by TrumpCare,
Yes.
and millions more like them.
Yes.
Whoops.
Millions.
And that's why we're here. Now, what is TrumpCare? TrumpCare, simply put, is a mess that gives you less for more. And TrumpCare doesn't discriminate against which Americans it hurts. Are you a millennial? TrumpCare means higher costs and less coverage. Are you a senior? TrumpCare means higher costs and less coverage. Are you a woman? TrumpCare means higher costs and less coverage. Are you or someone in your family living with a disability? TrumpCare means higher costs and less coverage. In fact, TrumpCare is really a tax break for the rich, not a health care program. That's the real motivation of so many of our Republican colleagues, to take people whose income is above $250,000 and give them an average tax break, to take the top 0.01% and give them an average tax break of $200,000 while making these people pay more. It's horrible. President Trump has talked about helping working America, but the plan he has embraced, TrumpCare, helps the rich and hurts the average American. And that's not surprising, given all the other things his administration is doing. This administration has developed a pattern. Healthcare is part of that. They talk like populists, but act like those helping wealthy special interests time after time after time. Look, no one likes this bill. Hospitals, doctors, governors, conservatives, liberals, nonpartisan groups, and most of all, the people who will no longer have affordable health care. So we Democrats are here today to tell our Republican friends, turn back, drop this irresponsible plan, stop this effort to repeal, and we'll work with you to improve the Affordable Care Act. But TrumpCare is a loser for just about all of America, unless you're in the top 1%. Now I'm going to turn it over to Senator Stabenow or Senator King, because he has to go to a hearing.
Yeah. Yeah.
I thought a lot about how to characterize this. By the way, it's not only Democrats, it's independents too, Chuck.
Thank you, Angus.
A way to characterize this bill, because we've heard it being discussed so much in the last few days. I think probably the easiest way to characterize it is repeal and wreck. Repeal and wreck. It basically undermines the premise of the Affordable Care Act, which is to provide health insurance access, meaningful access. And you got to be careful when you hear that word access, because lots of times my colleagues, when they use that word, they mean you can buy it. But they don't talk about whether it's affordable and whether you can afford to buy it. And that's what the problem with this bill is. If you were designing a bill to hammer my state, it would be this bill. A citizen in the northern part of my state, called Aroostook County, up near the Canadian border, a 60-year-old would see their support for their health care coverage diminish 70%. The average cut across my entire state for a 60-year-old is 48%, almost 50% in terms of the support for their ability to purchase health insurance. What this really is shift and shaft. Shift the cost from the highest income individuals to those who can least afford it, particularly seniors. I want to emphasize the real people who are injured the most by this proposal are people between the ages of 50 and 65, those who aren't yet qualified for Medicare, but who are still forced to participate in the individual insurance market. This is bad law, bad policy, bad economics, and bad health care. I believe that we can fix and repair and improve the Affordable Care Act. I've been saying that for 4 years. And if that's what we want to do, let's set about working on it together instead of bringing a bill literally from the dark of night with no hearings, no real substantive debate, no hearing from anybody outside, and within 48 or 72 hours pass it out of a House committee and take it on to the floor of the United States House of Representatives. That's not regular order, that's not transparency, that's not communicating with the American people. That is wrong, and it is harmful, and this is a bill that I believe deserves to go nowhere, and then maybe we can back away and say, let's fix it, let's repair it, let's look at the problems of the Affordable Care Act and make them and improve them and build on the fact that 22 million people now have insurance under the Affordable Care Act and more to come, and provide decent health care for the people of this country. I'd like to now recognize my colleague from Michigan.
Actually, we're turning it over.
We're going to Chris Von Hallen, who also is on his way to a hearing from the great state of Maryland. Chris?
Thank you, Angus. I want to thank Senator Stabenow for her understanding. And look, now we know why Republicans kept TrumpCare secret for so long, and now we know why they're trying to jam it through the United States Congress, because they don't want the American people to see what's in it, because the more people see what's in it, the more they realize they've been misled by Republicans and TrumpCare. This is going to wreck health care for tens of millions of Americans, including the people here and many of my constituents who are here. And it's going to wreck their health care while giving $600 billion in tax breaks to the wealthiest Americans, insurance companies, and pharmaceutical industries. As Senator Schumer said, if you're in the top 1/10 of 1%, you're going to get an average $200,000 tax cut. If you're a millionaire, you're going to get an average $50,000 tax cut. So it's great for members of the Trump cabinet, but it's rotten for 99% of the rest of the country. You know, this is not what candidate Trump talked about on the campaign trail. He campaigned as a populist, and what we're seeing every day is TrumpCare exposes the fact that it was a fake populism. This is a bill that helps the plutocrats at the expense of the American people. I am absolutely confident that when people take a good look at this, they're going to rise up, and they're rising up every day. Seniors groups, Americans organized to protect people with disabilities. As Senator Schumer said, the young, the old, and everybody else in between gets taken to the cleaners by this. The only people it helps are the folks at the very top who get this huge tax cut. That's not what they said this was all about, but it turns out this is simply a Trojan horse for $600 billion in tax cuts to the wealthy insurance companies and pharmaceutical companies. And I'm very pleased to turn it over to Senator Stabenow and thank her again for her understanding.
Well, thank you, Senator Van Hollen, Senator King, and of course, our great Senate leader, Chuck Schumer. Let's face it, this is a mess. This TrumpCare proposal is a mess on process and on policy. And let me say, as a member of the Finance Committee, who literally spent months, I think I was one of the few people who actually attended every single meeting on the Finance Committee talking about health care because of my own personal passion around these issues. And go back and check. This was months and months and months. The majority of 2009 we spent working, trying to get bipartisan support to bring something forward, but remaining committed every single day that every single child in this country should be able to see a doctor, and that all that comes with that for families. And then secondly, on the policy, as everybody else has been focusing on, it's really a triple whammy. It raises costs for families, it lowers health care coverage, and it raises taxes on middle-income families. Such a deal. It cuts taxes, again, for the very wealthy, for insurance companies, a special deal to allow the insurance company execs to get a pay raise while everybody else in America is paying for it, a special deal for pharmaceutical companies, while millions of people, particularly seniors and people with disabilities, are paying for it. And it leaves millions of Americans with pre-existing conditions at the mercy of insurance companies again. Don't let them tell you that people are going to have the same comprehensive coverage on pre-existing conditions that they do today. That is just not true. For those who receive their health care through Medicaid, that's the majority of people in nursing homes, majority of seniors, the majority of many, many children, those who work hard every single day in a minimum wage job, who now can see a doctor. That goes away, and instead they get a voucher. And so you get a voucher, and if you're a senior in a nursing home and the cost is higher than the voucher, tough luck. Your kids are going to pay for it. Your family is going to have to figure out how do they get the care for mom with Alzheimer's that she needs. Minimum wage job, same thing. If you have cancer, if you have a type of health crisis, it costs more than the voucher, you could be back in debt in bankruptcy and losing your house. And it cuts maternity care, birth control, and Planned Parenthood funding, 97% of which goes for primary care services. And as the person who led the fight in the Finance Committee on maternity care, I can tell you it's stunning to me, not only at the time that we did the Affordable Care Act, when there were colleagues that said that maternity care should not be basic in health care, but when the current person to head the Center for Medicare and Medicaid came before the Finance Committee, I asked the nominee if she felt that women's health care should be basic health care. And she basically said, as the new Secretary of Health and Human Services said, if women need maternity care, prenatal care, they can buy extra. So once again, being a woman is going to be a pre-existing condition. And let me finally just stress that AARP, a nonpartisan advocacy organization for retirees in this country, has come out strongly against the plan, calling it a senior tax. And according to them, premiums would increase on someone 64 years of age, making $15,000 a year. $15,000 a year, they would pay $8,400 more. That's half their income, more than half their income, in health care. But the good news is, if you are 64 years of age and you make over $3.7 million a year, you will get a tax cut of about $200,000 a year, which is more than what hardworking men and women in Michigan, the majority of those who get up every day and go to work and just want to get ahead for their family, actually make in a year. So the bottom line is, this is a mess. It makes no sense, and we will strongly, strongly oppose it. We want to turn now to some important guests that have joined us to speak from their perspective. First, Ola Ojawawi. Did I say that right?
Yes.
Ola?
Yes.
Thank you. And we'd like to have you share your concerns. And are we doing this? Thank you. Thank you so much.
Thank you so much for that introduction. I'm here today because of my health and the health of people like me and other women, other disabled Americans that are under attack. This bill would leave millions without critical health insurance, and it would eliminate women and men's access to an essential health care provider, Planned Parenthood. I'm an example of who this bill would hurt. By the time I was 12 years old, I had received both a heart and kidney transplant. And 6 years later, as I was entering college, I was diagnosed with a post-transplant cancer. I'm 26 years old today. Now, under the House's proposed plan, all of that could have been a death sentence. Instead, the Affordable Care Act allowed me to stay on my parents' health insurance until I was 26, so I could receive treatment and speak to you today as a cancer survivor. I went through chemotherapy last year at Johns Hopkins Hospital. The ACA ensured that I had coverage I needed to afford the 22 pills I take daily, my frequent hospital visits, and my wheelchair, the cost of my wheelchair. My story is that of thousands of disabled Americans and disabled youth that will be affected by this. The ACA ensured that I didn't have the additional burden of paying out of pocket for birth control. The reproductive rights of disabled women are too often forgotten, and birth control is not only used as a contraceptive. Rampant discrimination and disproportionately low incomes limit our access to health insurance, and assumptions about our personal lives prevent schools from teaching disabled youth about sex education. But Planned Parenthood is there, and it does. As a trusted healthcare provider, Planned Parenthood serves millions of people each year with essential reproductive health care like birth control, STD testing, and treatment, well women exams, and early life-saving detection of cancer. Planned Parenthood fills the gaps and provides sex education that many disabled people were denied. It provides the birth control that many assume we don't need, and it provides the health care that we deserve. Half of Planned Parenthood's health care facilities are in rural areas and in underserved areas. For many patients, Planned Parenthood is the only health care provider that they'll see. Cutting off this health care that so many rely on would be a health care disaster. Millions will have nowhere else to go. I'm terrified of what will happen if this bill passes. More than 10 million people with disabilities are eligible for Medicaid, and Planned Parenthood is a critical resource. People don't come to Planned Parenthood to make a political statement. They come for the health care. When I was at President Trump's joint address to Congress, I heard him say that he wants to invest in women's health. Well, here's your chance. Invest in women's health. Invest in disabled women. Don't put political gains in front of human lives. Yesterday, Paul Ryan chose to celebrate International Women's Day by holding a press conference doubling down on this attack against women's health. Even though it would mean women in his own district would go without this critical health care. I'm here to join all of women around all over the country and on Capitol Hill that are telling Paul Ryan and the members of Congress that we won't stay silent. We're going to fight to protect our lives, our care, and our right to choose our healthcare providers. Thank you so much for this opportunity to speak.
Thank you. Oh, that was very powerful. Thank you. Thank you very much. Great. That was wonderful. Thank you so much. You know, what Ola's really talking about is healthcare is not political, it's personal. And that is really the point that we are trying to stress over and over and over again. Bob Matha from Baltimore, Maryland is here. Come join us. Here, we'll let you right there.
Okay, great.
Thank you.
Thanks very much. I'm one of the people that the Republicans in this building should really like a lot. I've paid taxes every year of my life since I've been 15. 20 years ago, I started my own business and employed a lot of people, and I provided health care to them. Now I'm a few years from retirement. And I got to tell you, Obamacare has been very important to our planning and my ability to retire. it guaranteed over the last few years, as my business became smaller on purpose, that I could get health care. I didn't have to be in a big group. I could buy it off the exchanges and make sure that the retirement money that I've set aside for myself isn't just taken away by some sickness. My beautiful wife here has been very benefited by Obamacare. She has vascular Ehlers-Danlos. It's a genetic condition that you don't want to have. And insurance companies don't want you to have it or have anything to do with you if you've got it. We used to be in the high-risk pool, something I understand they want to go back to. We don't want to go back to high-risk pools. They suck. They're very expensive. The care is iffy. You can't move. They're just very restrictive. Obamacare has been fantastic for us. Now they want to take it away. I don't get it. Why? I just don't get it. Don't they like us? I mean, what did I ever do to these folks that they should take something that's been very beneficial to me, to my wife, and all of these people? Why do they want to take it away? Is it because I'm not rich enough? I've saved, I've done all the right things, and now at the last minute, boom, I'm going to retire in 2 years. I'm looking down the pike, I don't know, how am I going to be able to afford her health care on a limited fixed income? It's going to get tough, especially if they start screwing around with Medicare. I'll get that in 2 years. Hopefully it's there. So I just have one request for the senators and the people in this building, at least on our side. Don't give in. Don't give in to their pressure and their screwball ideas, because all they're after is trying to help rich people and their friends. And I'm tired of it, and I think we all should be tired of it and not put up with it anymore.
Thank you. Yeah. Thank you, Bob. That was great. Thank you very much. Thank you, Bob. Thank you so much. Rory O'Sullivan, Deputy Director of Young Invincibles.
Thank you, Senator.
Good to have you.
Thanks so much.
Thank you.
Good morning. Oh,
Do this.
excuse me.
Okay.
My name's Roy O'Sullivan. I'm the Deputy Director at Young Invincibles, and we're a policy and advocacy organization dedicated to expanding economic opportunity for young adults. Now, I'm here today because the new Republican health care plan would be a major step back for millennials' health and financial security. Under the ACA, we've seen the young adult uninsurance rate drop nearly in half, from 29% to 16%, and would have fallen even further had all states expanded Medicaid. But the new Republican plan would increase the number of uninsured people, drive up costs for most millennials, and make it harder, not easier, for our generation to get covered. Now, Republicans in Congress have said that they want to improve young people's access to coverage. But the plan that they released this week would do the exact opposite by imposing a millennial penalty. And what I mean by this is it would punish people who experience unexpected life events, like getting laid off, or moving, or changing jobs. And these are events that often lead to lapses in coverage and disproportionately impact young adults. So if you end up being exposed to one of these events, you're going to receive a 30% surcharge when you try to enroll in coverage. And that's where there's a millennial penalty that disproportionately impacts our generation. And it's going to have the opposite effect of making coverage affordable for cash-strapped young adults. The bill would also end Medicaid expansion, which has helped about 4 million young adults get covered, and impose per beneficiary caps that will force states to ration care and restrict enrollment eligibility. The bill would also defund Planned Parenthood, which we've just heard about, which helps millions of young people every year get the health education and care that they need. And I hope Republicans will say no to this plan. It's bad for millennials' health and penalizes people for trying to get covered. Thank you.
Thank you so much, Roy. That was great. Thank you. Thank you so much. And last but certainly not least, we want to hear from Kent Kieser, who is going to share his experience. Kent?
For people with disabilities, health care is a lifeline. It's a lifeline not only for our personal health, but a lifeline for education. It's our lifeline to our employment, and a lifeline to our contributions to our community and to our country. The lifeline was significantly strengthened by Obamacare, but the American Health Act threatens that lifeline. The fact proposal, as Senator Stabenow just said, cuts and caps Medicaid is proof enough. As the Consortium for Citizens for People with Disabilities has pointed out, under a Medicaid per capita cut and cap, the federal government would set a limit on how much to reimburse states on enrollment in the Medicaid program. Under current law, funding is not based on actual cost of providing services. Much like the proposed block grants, the intent of the per capita cuts and caps is to restructure the program and save the federal government money. Inevitably, there will be cuts in funding to the states. The negative impact to Medicaid recipients could include losing home and community-based services and supports. Waiting lists would quickly grow, losing other critical services such as personal care, mental health, prescription drugs, and rehabilitation services. Being forced into unnecessary institutionalization, states could return to the days of warehousing people with disabilities in institutions. I got one more. The cost of providing health and long-term services and supports will not go away, but will be shifted to individuals and families. We stand solidly with Senator Schumer and his colleagues in their support for the disability community. Thank you.
Thank you very much, and thank you to each of you for being here today. I'm happy to take questions, and let me just stress again that there's a lot of political slogans that have been going on for a long time, but as everyone here has talked about, this is personal for people, and that's why it's so important. Yes?
Yes, Senator, President Trump supposedly is telling people that if Democrats block this Republican plan, he'll let the Affordable Care Act just collapse on its own and blame it on the Democrats. What do you think?
Well, if President Trump wants to do that, he certainly, if he wants to let the current healthcare system that's affecting every single person here that Kent just talked about, let it collapse because we won't accept a disastrous alternative, then I think as President of the United States, he can take that responsibility.
Do you think it would collapse?
I'm sorry?
Do you think it would collapse?
Well, I do think that already, because of the talk of repeal, they have been destabilizing the insurance market. So they passed a resolution, budget resolution, that said they were going to pass a repeal by January 27th. Now, they've not been able to do that because people have spoken out. People that are impacted, children, families, seniors, people with disabilities, small businesses, people have spoken out. But because of the talk already, we're seeing insurance companies make decisions. I've talked to hospital administrators who are very concerned that just the idea of repeal, even if it's passed now and doesn't take effect for 2 years, will affect the decisions they make about investing in equipment, business decisions that they make. It's inevitable. So they are right now destabilizing the system for politics so that they can somehow say that the system that has been put in place that covers 30 million people with health insurance and 97% of the children in Michigan who can now see a doctor, that somehow that's bad. 97% of the children in Michigan can now see a family doctor. What I want to focus on is making it 100%, not making it 3%. And so it's all, unfortunately, driven by an ideology and politics and not what is important for people in this country to make sure that they don't go bankrupt, don't lose their house because of catastrophic health events, or that their child who has a cold doesn't turn it into pneumonia because they couldn't get them to the doctor, or that they're only using the emergency room. I mean, all of those things have changed. And do we need to make it better? We still have cost issues. I want to focus on the places where premiums are too high, co-pays are too high, where we need to help small business, but not roll us back. Yes. Well, at this point, I don't see where there are enough amendments to fix this. I mean, this is a mess. If Republican colleagues want to stop this idea of repeal and sit down with us and focus on making health care better and lowering costs in places where that's needed, then we're more than happy to help. Yeah.
Are you actively talking to lobbying for the other female senators on the Republican side, trying to secure a no vote?
Well, we have colleagues already who have said, 4 Republican senators who have indicated that if this does not continue the health care coverage through Medicaid expansion, that they're not going to support a plan. And again, that's nursing home care as well as children and minimum wage workers. So there are a lot of discussions that are going on, and particularly in the Senate, where people represent rural communities where rural hospitals could close, as well as urban areas, and have a broader perspective on this. I think they're going to have a tough time. Yes, here and then here.
Republicans are saying that this is one of 3 phases. The third phase would be 60-vote threshold in the Senate with big fixes. What pressure would you feel if they pass this phase to sign on any of their reforms, especially if the president said he was coming to Michigan to campaign for the plan? What pressure would you feel for him?
If the president wants to come to Michigan and campaign for this plan, I think it'd be terrific. We'd welcome him to come and talk to the people in Michigan who, with all sincerity, supported him because they thought he was going to make their lives better. And let's talk about what happens when they lose health care. And when their parents lose health care in their nursing home and their child can't see a doctor. So I'd welcome that visit.
There seems to be an effort from the White House and Republicans in advance of the CBO score coming out to downplay the significance. What do you think about this? Do you think it's an attempt to diminish the results before they even come out?
Well, I would love it if you have a chance to go back and Google everything that has always been said about moving forward with legislation without having information about what it costs, over the last number of years, and compare that to what's being said today. I think you're right. That I think what's been said about trying to diminish the significance of worrying about how it's paid for or how much it costs is an effort to try to diminish what is a nonpartisan budget office, actually, whose director is appointed by Republicans. The Republican majority appoints the budget director. It's nonpartisan. I sit on the budget committee. And the fact is that they call it as they see it. And the health reform that we passed saved dollars. It's actually, and which is one of the difficulties in the big sense of the federal budget. And I have to tell you, just coming from Michigan, the state of Michigan, which did expand Medicaid, has just announced in their budget that they are going to add about $500 million to the state of Michigan coffers in savings, because Medicaid has worked to have people not coming into the emergency room, but going to a primary care doctor. And that it's done exactly what we wanted, which was to save dollars. And the state of Michigan is going to be ahead by almost $500 million because we did that.
What does that effort tell you about what Republicans are bracing themselves for early next week when that score comes back?
Well, I think, first of all, our Republican colleagues really are the dog who caught the car. They've been passing these repeals for years. They knew they didn't have to be held accountable for it because President Obama would veto it. We would stop it if we could. So now they have the political rhetoric of campaigns, and they're trying to figure out what to do. And when the CBO comes out, it's going to show that this costs a lot of money, and that it shifts costs from working people, middle-class people, onto the wealthy. I mean, it is stunning that the first thing they want to do is make sure they're giving a tax cut to the wealthy before they even focus on how they're going to continue health care for middle and low-income people in this country. And when people earning $3.7 million a year or more are getting on average $200,000 tax cut, people in my state are going, wait a minute, I'd love to make that much in a year.
Last question.
Can you respond to Senator Peter McConnell when he says the Medicaid expansion in Illinois has led to hundreds of people dying while waiting for care, and its premiums have gone up so much that many people can't afford a home care.
Well, I would say, I don't know about Illinois. I can tell you about Michigan, where in fact 97% of the children are now covered and their parents can take them to a doctor rather than into an emergency room. Our state of Michigan, what is entirely Republican controlled, Republican governor, Republican House, Republican Senate, to their credit, expanded health care coverage under Medicaid and are now adding almost $500 million to next year's budget because it saved them money. Now, in terms of costs around the country, there are places in this country where there's not enough competition from insurance companies. This is based on a private insurance company model, which means insurance companies have to be willing to cover and to compete. That's a legitimate issue, and we need to address that. You don't address that by taking away health care coverage for everybody up here or taking away healthcare coverage for people in Michigan, but it's true. I think there are parts of the country and parts of Michigan where the premiums and copays are too high. We need to take the next step like we've done with any other major healthcare law. Medicare's been improved over the years. Medicaid's been improved over the years. The VA, I mean, every other healthcare system, you look at it and say, you know what? There's problems. So let's fix it. And if they want to fix those issues to bring costs down, count me in the room. Thanks very much, everybody. Thank you so much. I'm so glad we could get some sunshine today. We have been out here when it was freezing.